What are we going to do first?
So first we will do a article, one of the articles, and either you do an article first or I do an article first. First we'll chat a little bit. And then we'll do some hot news. And and I made a little jingle for that, so we can put it in between.
Sorry for Saying Sorry Media presents the Purrpodcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary professional healthcare team. If you are dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and author of multiple textbooks, and Dr. Jolle Kerpenstein, talented surgeon and social media geek.
Hello, this is Dr. Jolle Kerpenstein.
And this is Dr. Susan Little.
Hey, Susan, how are you doing?
Well, I'm good. I'm actually on vacation, so, you're really lucky to be talking to me.
I just want to say, you're on vacation where?
I'm on vacation in gorgeous Nova Scotia, Canada. You've been here. You know how beautiful it is.
It is beautiful. I loved it there. And not only because they have great oysters.
Great seafood in general.
I know. We had a lot of seafood when we were there.
Yeah.
And I loved it there. It's beautiful, beautiful scenery. So the weather is good. It's not raining and that sort of thing.
Oh, it's gorgeous because this podcast will get aired a little bit later, obviously, than when we're recording it. But we're recording it in August, and the weather is just gorgeous. So I'm very happy.
So the best time to go to Nova Scotia is August then?
July and August, yeah.
Don't go there in January. That's all I can say.
Or December.
Exactly.
Yeah.
So this podcast is really exciting. So the first news is that downloads are going crazy. So we had so many downloads of the first four podcasts that we did. The fourth is coming out this week. Four podcasts. So the last one, Sarah, did really, really well. So happy that she joined us. And then when we aired this one, probably Sarah has done the number 5 too. So then we have had 5 podcasts. And this is number 6.
Yeah.
And I am so excited that this is number 6 because we're going to do something different.
We are. We're really feeling the love, though. It's so cool that everybody is downloading and listening to our podcast, and we'll continue to get some cool guests on with us. We've got some plans that's coming up to get some more cool people talking to us. But we're going to be cool people talking to each other today.
I know, and it's so funny. So what we're going to do today is that we're going to, as a matter of fact, we asked each other to look at some articles about cats that we thought were really interesting, and we're going to discuss them. And so we have some really cool discussions going on. So about the context or content of these articles. And I'm in Kansas. It is gorgeous here. It's a little hot, but for the rest of the things are well. It's beautiful, sunny, and I'm very excited. So I should be outside, but I'm on the phone with you right now, talking about cats, which is even better.
Well, it's at least the next best thing. And you should feel very lucky because I picked the study that we're going to talk about today. And you should feel lucky because I picked a surgical topic.
And I almost fell off my chair when I read that. I was like, what? So now, at last, she has the chance to speak internal medicine all the time. And what does she do? She picks out a surgery article. So that is quite interesting. So before we start, I just have to say I'm listening to a new podcast, and this is just for general information. And it's called Two Dope Queens. I don't know if you ever heard them, but they're fantastic. It's really funny.
No.
But when I listened to them, I had to think about us two, the two dope vets talking about cats. So that's my inspiration. But and they're really funny, and I think you are really funny too. So let's do it.
I think we're pretty funny together.
I know. So two important messages. One is, if you like our podcast, please rate them 5 stars in anywhere where you download them. And if you want to give a review, that is wonderful. If you want to share the podcast, that is even better. We're very excited to do this. So we are going to discuss 2 articles, and the first article is yours, I guess. So talk to me. What is this about? Surgery! Yay!
It's surgery. But so the reason I picked this is because although it is a surgical topic, it is a topic that you never hear anybody talk about in cats. So that's why I picked it. And so I picked an article that has come out this year, 2018, in the Journal of Veterinary Emergency and Critical Care, and it's called Spontaneous Gastric Dilatation Volvulus in 2 cats. GDV in cats. And it comes from Angel Animal Medical Center in Boston, from the Emergency and Critical Care Department there. So I picked it because whoever talks about GDV in cats, there's lots known about GDV in dogs. And even though this is an article only about 2 cats, the authors point out that there is hardly anything in the literature on GDV in cats, especially compared to what is in the literature on dogs. And so even though they only have 2 cases to report, they felt, I think there's only 8 other cases in the literature. So adding 2 cases, that's a good percentage. So they felt it was important to add these 2 cases.
Yeah, and you know what the best news is?
What?
It's about surgery. So
it's
that is
surgery.
perfect, and I'm so happy that our first article is about surgery. And so do you read the Journal of Veterinary Emergency and Critical Care often, Susan?
I do, actually. I like that journal.
Mm-hmm.
Yeah.
Me too. Me too,
yeah,
because it's a nice cross between internal medicine and surgery. And,
exactly.
And so it's really cool. I think this is a very good topic. So let's start. So what is it about? And so the idea here is that when you do an article, you just explain what's it about, and I'll ask poignant questions and vice versa. So
okay, cool.
Perfect.
This is about 2 cases of GDV in cats, and the other reason I picked it is not just because there isn't any GDV cases, hardly any in the literature on cats. It's because even though they only talked about 2 cases, they pointed out some really important differences between cats and dogs with GDVs. Now, I'm guessing that in your career, Jolle, you've treated a lot of dogs with GDVs.
I did hundreds and hundreds of them. But I did see a GDV in a cat too. Yes, I had one. So I'm very excited. Yeah.
Okay.
So I can talk to you about it.
Oh, good. So, but they pointed out some interesting differences between cats and dogs when it comes to GDVs. Mm-hmm. And a couple of interesting differences. And one of the interesting differences between cats and dogs was the presenting clinical signs. So now, way back, many, many moons ago, right after I graduated, I did practice what I call mixed animal medicine. So
No way.
Yeah,
no way. Stop. Let's stop the tape right here. You did what?
So I call it mixed animal medicine. It was dog and cat practice. To me, that's animal medicine.
I thought you did cows. cows and goats and horses and that sort of thing. Oh no, only dogs and cats. Okay.
Yeah.
Got it.
So not even 2 years. So like let's say about 2 years. And so I certainly saw enough GDVs with dogs in that period of time. And they always present, well, not always, but they often present with gastrointestinal signs, right?
Yeah, always, almost always. I
mean,
always. You know, the retching without content is the number one sign that we see. If someone says to me and I'm on the phone and says, hey, my dog is trying to vomit and nothing comes out, you know, I know what's wrong. There's only one thing that can do that, and so we rush him in and do surgery.
So what was really interesting to me about these cats and the other cats in the literature, there's only 8 other cats, so now there's like a total of 10 cats in the literature, is that one of the interesting things is that cats tend to present with respiratory signs, with respiratory distress. So we can add this to that long list of things that causes respiratory distress in cats. And so that's quite different.
And there's lots of things that can cause that, so that doesn't make it easy. But there is a combination with another sign that is really important in these cats.
Yeah. So there's a number of things that was important. And in the 8 cases in the literature, 5 of the 8 cases in the literature were all associated with trauma. And I'm guessing that when you look at dogs with GDVs, they're typically not associated with trauma, are they?
Correct. No, they're not.
Yeah. So these cats, not the 2 in this case report, but of the 8 in the literature before this, 5 of the 8 in the literature are associated with trauma. So, you know, now we've got 10 cases in the literature and half of them are trauma associated. And the trauma caused a diaphragmatic hernia. So in cats, we really have to be aware of a possibility or ask about a history of trauma and the possibility of a diaphragmatic hernia. So that's another difference. Another difference was these cats seemed to go longer before they came into the veterinary clinic after. So they had clinical signs for at least 24 hours before presentation. And that's also seen in the other cats in the literature. A number of those cats also had quite protracted clinical signs before they came into the veterinary clinic, whereas and their survival was still good, right? But with dogs, my understanding is the shorter your clinical signs when you are presented, the better your outcome. So the longer you go before you get presented to the veterinary clinic, it decreases the chances that you're going to survive the event. But that relationship doesn't seem to happen in cats. So I know you're supposed to be asking the questions, but I'm curious, why do you think that is? Why do you think these cats were able to have clinical signs for so long and yet still have good outcomes, where in dogs, people talk like about a 6-hour window, you know?
Yeah.
Big difference.
Yeah. I think that is the answer. So we know in dogs that, you know, most of them, the torsions in the dogs are pretty severe. So they rotate around 270 degrees. And what I saw in these cats is that most of the time it's a rotation of like 90 degrees to 180 degrees. So there might be not a complete obstruction, and these dogs often pant, and so they aspirate a lot of air, and then the stomach, you know, increases. So that's why it's so important to be early, because we know that there is a significant correlation with the health of the stomach wall and the survival of the dog. So the longer you wait, the more chance you have of necrosis of the stomach wall. And none of these articles in the cat talk about it. So either the cat's stomach is a little bit more flexible, or it doesn't rotate as much, so the vascularity is not so much as involved. So I think those are the reasons that cats have a little bit longer. So it's even now. Because I forgot the ones of the diaphragmatic hernia. So in cats, there is very few reasons to cut a diaphragmatic hernia immediately, except when the cat is super dyspneic. And the interesting thing is that super dyspneic cats with diaphragmal hernia often have a translocation of the stomach into the chest. And that is absolutely an emergency. So, yes, those stomachs are torn often. And so I didn't even think about those. Normally I see that a different part is, it's just a stomach rotation into the chest. And I didn't even realize that was a separate category. So this is really cool.
Yeah.
So, but I had 2 of those. So now my number is already 3. Yay.
Yeah, there you go. Yeah. So it is a separate category. Now, it is a little frustrating because these few reports of GDV in cats in the literature don't tend to remark on the degree of torsion of the stomach. So we don't really know. But I think it makes sense what you're saying, that, maybe cats don't tors as much, or they, I don't know, they maintain some better blood supply even as they tors. Who knows? So it's a little hard to say.
If I look at the radiographs of the article, it kind of looks like they're not torsed as much. I mean, it's more rotated than a full torsion. But I don't know.
That was one of the things they pointed out, though. They pointed out that on the radiograph, you'll see that big distended stomach, but you may actually not see evidence of volvulus on the radiograph in the cat. You won't see it until you go in surgically. So maybe that does provide more evidence for what you're saying, that they may have a lesser degree of volvulus than the dog.
Yeah, that could be totally possible. Although I have to say that I think that the first picture that they showed is a typical torsion again, because it has a compartmentalization, and that's very typical. So,
Now, these 2 cases that we're talking about that just got published this year, these 2 cases were not due to trauma or diaphragmatic hernias.
Nope.
These were actually, interestingly enough, I think they were both Persian cats, which is probably, I suspect, just by chance, but they were both Persian cats. And one of them had a foreign body discovered at the time of surgery. And guess what the foreign body was? Persian cat. What do you think the foreign body was?
It was a hairball.
It was a giant hairball. Yeah.
That reminds me of our talk, remember? That you showed this cat with the big hairball? That's it.
I did. I have a bunch of pictures of cats and giant hairballs. So you don't usually think of a foreign body as a cause of GDV. But you know what? Here's what I think. Cats that get these giant hairballs probably have an underlying motility problem anyway. And they said in the article that they did not do biopsies of the cat with the hairball. So it may have had some underlying small intestinal disease. Who knows? And the other cat, they also didn't do biopsies on, but they're presuming the cat may have had some underlying, like, inflammatory bowel disease. And that makes sense to me, that there may be an underlying motility problem. So what we call idiopathic, these cases that in cats, GDVs in cats that aren't associated with trauma, and they're called idiopathic. My first guess is that they may be due to an underlying gastrointestinal disease causing hypomotility.
And I so agree with you. And I know that in dogs, as much smaller dogs, we kind of think the same thing. So there is a motility problem. So in the large breed dogs, it is, we always say, the how the dog is built and maybe the stability of the stomach or how the stomach hangs in the abdomen. But with the small breed dogs, we always think about an underlying disease. And I've seen, as a matter of fact, a couple of foreign bodies causing this in dogs. So I'm not surprised that the foreign body would do it. And for me, it's a really strong indication, once again, that if we get these really cool cases, do biopsies. I mean, it's so important to find out what is wrong with it. And so that was, if you have to be critical about the article, that's one thing I was a little critical. Disappointed is a better word. A little bit disappointed.
Yeah. But you know how it goes, right? You get a case and you don't really think of that bigger picture, right? And then, I don't know, a few years later you get another case and all of a sudden you have a case series. So it isn't exactly a planned thing, is it? Right? That's just kind of the way it evolves. And so when they're uncommon things like this, you're not really thinking necessarily of that bigger picture. But in their article, they did talk about that possibility of hypomotility as an underlying disorder. So, I think one of the good take-home lessons from this is that cats can get GDVs, and that it should be added to that list of potential differential diagnoses when we see cats with respiratory distress coming in. So both of these cats came in with, obvious respiratory distress, vocalizing, obviously quite distressed cats. And so we typically think about cardiac disease, we think about respiratory tract disease, because those are the two big buckets, the two most common reasons. About a third of cats that come in with respiratory distress have congestive heart failure. About a third of them have respiratory disease. And then a third have other things. And in that group of other things, I think we have to make sure that we think about GDV in there and be very careful with our history, especially knowing that trauma potentially causing diaphragmatic hernia and a GDV seems to be a thing that cats do.
Yeah. And I think that the other important thing is that with the distress, so once again, if we go back to the D word, dogs that are very dyspneic tend to aspirate a lot of air. I don't know if that's the same thing in cats. So maybe the person thing and them being dyspneic from their own, and there's something else that makes it worse, might make them aspirate more air, and that air goes to the stomach, and then the stomach is tense, and maybe it forces. That could be a reason if there's no underlying disease for that. The other thing I thought was interesting was the surgical technique that they use.
Okay, yeah. It is a surgery article. We better talk a little bit about that surgical technique.
I know.
So what did you think? What did you find so interesting?
Yeah, so they used the belt loop gastropexy, and I know in the U.S. it's very, very common, and people like that. And the belt loop is that you make kind of a incision in the stomach wall. It looks like a little U incision, and then you pull that incision, or you kind of free it up from the so it's an incision in the serosa and the submucosa and the muscle, and then you free that up, and then you pull that through an incision or a little loop that you make in the abdominal wall, and then you suture it back to the stomach. It is a very difficult surgery in dogs, and I cannot even imagine how difficult it is in cats. So most of us say, that it doesn't matter how you fix the stomach to the stomach wall, or not to the abdominal wall, as long as you do it.
Right.
So I would never use a belt loop in a cat. I would just do an incisional gastropexy. Much easier. Okay. And so, and this is the big lesson, that when you read articles, always be critical. So I like this article. I'm very happy with it, but that's something that immediately jumped out to me and said, why would you do a belt loop? I would just do an incisional. Yeah. And then the other important thing is that we normally suture, so as a matter of fact, the pylorus to the, and then it's the right side of the abdomen. So that's abdominal wall. So we suture the pylorus. And that's because of that's caused by us in dogs, because rotation is normally that way. These were both clockwise rotation, so that would guesstimate kind of that you should do the same thing in the cat, but they really didn't talk too much about that. So once again, I would just use the dogma, which is once again a kind of a lost opportunity, because this is so uncommon. You really need to not only describe the emergency parts to detail, but you also need to describe the surgery part. So that kind of tells me the surgery was the less interesting part of the article, which is too bad. So for me, I would never use a belt loop. I would just use an incisional gastropexy. There's no difference between tensile strength and the chance that they come off, et cetera, et cetera. So.
Yeah, so in dogs, it doesn't play into whether they get recurrence.
No.
Okay. No. And so the one last thing that I wanted to point out about this, now I said off the top that it was 2 Persian cats and maybe that was just by chance, but now that I think about it, Persian cats often have stenotic nares, right? So I wonder if, some increased airway resistance, not that it caused things, but it exacerbates things, right? Because they're bracketing the balance. That's also really good. Yeah, so really interesting.
It is, and there's a couple of other things that I thought was important. One is that one cat had big problems, but the surgery really didn't help them. So that's really one that goes back to the first. We still don't know if it's the case.
Yeah.
So you definitely picked up the fact that they didn't look at, I suppose,
missed opportunity. Yeah.
So there was a comment that said that sensitive cats with nasal were
Well,
Go ahead.
I'm not sure that they, maybe at that point they didn't actually know or weren't ready to suspect that it was a GDD, right? They, again, it's uncommon. It's not the first thing that comes to the top of mind. And, we do see cats with pulmonary causes of acute respiratory distress that do swallow air and they get big stomachs. So I've seen a lot of air-filled stomachs on radiographic cats, and I have to tell you, GDD does not come to the top of my mind.
But
right? Maybe it will now.
Do you put a nasogastric tube in those cats?
No. So typically I don't. So we try to treat the cause of the respiratory distress, right, hoping that if we can normalize respiration, that will sort itself out.
I think you're completely right there. There's 2 reasons why I don't think it works. One, it is a very thin little tube that I don't think you even get it into the stomach because, it's stored. So you can't get it in very easily. And then when you get it in, it probably is kinked or compressed, and so you don't get the air. In dogs, we use the biggest tube that we can get to get that stuff out. And it's often a combination of air and other stuff and content. So, as a mercury, I used to use equine nasogastric tubes, which are the really big ones, and put them in the dog to get release. So you really need something bigger than just a nasogastric tube. But I don't think the cat will be very happy. Dogs are so stupid that they just allow you when they're so sick to put that tube in.
Well,
the cat definitely will not.
About the biggest you're going to get a nasogastric tube in a cat, it's going to be a 3 or 5 French. And I think your point is really well taken. That's really not big enough to allow fluid to escape, right, or air to escape. So I suspect it's a bit of a futile effort.
Yeah, so really cool. I think this is a wonderful article. And as Murphy, we're already at 30 minutes, so we can only do either we do a hot, we have a new topic which is hot cat news, and so we both look at the internet for the latest and the greatest cat news. So we only have time for 2 little hot cat news items, and then we have to switch off again, and then the next article will be our next podcast. So what is your hot cat news, too? And now, hot cat news.
Okay, so this is just a quickie, and it's just like interesting, and it's something you can wow your friends with at dinner. So it's not necessarily going to, it's not going to change your life as a veterinarian, but it will make you look cool at dinner when you're talking about trivia. And so Yeah, and so that is researchers at Queen's University in Belfast found cats have a paw preference. Cats can be right pawed or left pawed, which is something I did not know. Yeah. Just like we are right-handed or left-handed, cats are right pawed or left pawed. Even more amazing, female cats are likely to be right pawed and male cats are likely to be left pawed. How do you like that?
That is crazy. Really?
Yeah.
So if a cat hits you, it's either so when a cat hits you, you can know if it's a male or a female just by the paw.
Yeah.
That animal uses.
So I have 2 male cats and a female cat, Frank and Brian and Meredith, right? And so now I'm going to watch them quite closely and see
did you test it out?
If Meredith. I will. I'm going to. I'm on vacation, right? So I can't do it right. But when I get back, I'm going to look at Meredith very closely and see if indeed she is right pawed and the 2 boys are left pawed. I'll check it out and I'll let you know.
That's really cool. So my hot cat news is I read an article in the National Geographic online where they used fish skin bandages to help heal. Did you hear about it?
Yeah.
So they used fish skin bandages to help heal bears, but not only bears, also because then you would say, what does that have the hell to do with cats? But there was also a 5-month-old cougar from Las Padres National Forest that had the same problem. So they treated that poor little cougar with fish skin, and this is tilapia skin. It has been described in Latin America quite a lot to use. It's also being used in humans sometimes. They then used, it's radiated, and it seems to help healing, which I think is really cool. In this case, they used fresh skin, and then they had some kind of method that they sterilized it with. That sounded all a little bit fishy. That was my little joke there. And as a matter of fact, they don't smell like fish, but that was another lady that said that. But so it says that the cougar cub is doing well with the treatment, and the tilapia skin has certain collagen proteins that are, according to the article, essential for scarring. So I thought that was really cool because I have to give a webinar about wound healing in a week. So I'm going to use this as an example. There's also there's more holistic parts of the article that probably don't have a lot of science behind it, but I thought this was really cool.
Yay!
So, Susan, we revamp this podcast every time, and now we had a great idea, which was to let our fans ask us questions. And I put that, I think it's awesome. I put that on our Instagram page. So we have a Purrpodcast Instagram page. And if you go there, you can post your questions. And by posing a good question, you immediately become a Purr VIP, a very important person. And
so what does that mean, though? What does it mean if you're a Purr VIP?
That's an amazing achievement that you can reach in your life. Why?
I think, am I a Purr VIP already?
Of course, because you ask me questions all the time, Drive me nuts with all those questions. Nuts. No.
Good.
So yeah, I guess we are Purr VIPs too. But the good news is that I posted that on our social media channels, and we immediately got a question. So I am going to look up the person right now who posed that question, and I should have that already, but I don't. So I'm going to cut this off.
It's a veterinarian it's a vet from Rio de Janeiro. I remember that.
Yes, it is Ana Escalera, and hopefully I will pronounce her name well. And
yes, we're sorry, Ana.
Apologies. But Ana is a vet from Rio de Janeiro, and that's really cool. And so thank you, Ana, for posing the first question. And her question is to you, Susan, because you are probably the expert in this. Should I start checking SDMA for cats And if so, at which age?
Wow. So that is really a good question for our first listener question, because there isn't I'm going to say there isn't an easy answer to that. So what I'm going to tell you is what I would recommend, because I don't think we have any data published to tell us exactly the right age to start looking at that in cats. So here's what I would recommend. So just to remind everybody, SDMA is the metabolite that we look at in the blood to give us earlier diagnosis of chronic kidney disease. So it is an estimate of glomerular filtration rate, and it doesn't replace creatinine, but it has some benefits over creatinine in that it detects changes in GFR earlier than creatinine, and it isn't affected by decreasing muscle mass, which is particularly important in cats. So in the last couple of years, mainly through IDEX, this test has become available. So the question is, should you use it? And short answer to that is yes, you should use it as long as it comes from a reliable lab. Number two, when should we start looking at it? So certainly if there's a patient that you suspect has chronic kidney disease, one of the things we want to look at is SDMA. But I think there's also a place in screening cats for health conditions. So one of the things we don't do often enough is this proactive approach where we start doing, let's say, annual blood work and urinalysis on cats in their middle years, looking for early detection of disease. And I do a whole lecture on that, so I'm not going to give you a whole lecture now. So I think there's a benefit to including SDMA. No, I won't. There's a benefit to including SDMA. I think in your screening blood work, that sort of annual wellness type, annual preventive health care type of blood work, starting in the middle years. So for cats, I'd say starting at somewhere around 7, 8, 9 years of age in there, even in healthy cats. So I'd include it in your screening blood work, and then I'd certainly include it in any cat that has clinical signs that could be, or physical exam findings consistent with chronic kidney disease. So that's what I would recommend. Hopefully that helps answer the question.
That's wonderful. And the interesting part is I forgot to tell you that we need to answer these questions succinctly, which means like 5 minutes of talking, Susan. But no, that's great. So just to summarize, so if you have cats that have clinical signs, yes, absolutely do it.
Yeah.
If you have cats that you do a routine blood work on, start
which I recommend.
Middle age, which you recommend, middle age, 7 years plus. And then I would like to add here, any cat that has a history or maybe a increased chance of getting renal disease. How about that? Good answer. Thank you. So no, that wonderful answer. Thank you, Susan. I'm very happy with our first question. I'm so excited here. I'm just sitting here smiling. So thank you, Anna, for this question.
Yes, thank you, Anna.
And hopefully, and you are our first per VIP after Susan and myself, obviously. But very, very happy to have you in the per VIP family.
Yay!
So very good.
Very cool.
As a matter of fact, this is the end of our podcast. I thought we wanted to do 2 articles, but that didn't work. So because we are talking too much, but that's really cool. So Susan, thank you so much for this podcast.
And thank you, Jolle. And you should be thanking me even more so because I picked a surgery topic.
I know, and I will never forget that. GDC in cats. That was a really cool topic. That's great. So thank you so much, and we'll talk to you later. See ya.
Yeah.
Bye. Hello, this is Dr. Jolle Purrpodcast. Thank you for listening to our podcast. Please note that all opinions given here are purely Dr. Susan and my interpretation. Veterinary medicine is a beautiful but complicated profession, as no animal or case is exactly the same.
Well, there's one thing for sure.
Yeah.
Jolle and I have strong opinions, and we're not afraid to say them. So that's a good thing, though, isn't it?
That is a good thing. That is a good thing. So, yeah, I just want everybody to be sure that, there's multiple ways to run. And so that's an old saying, which means that often what you need to do and how you do it is not completely clear. So we are using either our experience or, our clinical cases to sometimes drive, and sometimes we use real evidence-based medicine, and we normally say that.
And sometimes we just use opinions of other experts that we trust, too.
And that's true. So, okay, great. I think that is what everybody needs to hear.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat Clinical Medicine and Management and August's Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs. You can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kerpenstein is a diplomat of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently for Hill's Pet Nutrition. You can follow him on social media with the handle @GVetSX.